right. So welcome everybody to this month's community call. I think we titled it The Two Faces of Ketamine. And today's call we'll be going over um, some of the medical side of ketamine. We have Paul and Jasmine here from Whole Mind Healings, two beautiful people I've had the chance of working with. And then we have Ursula here who will share a little bit about her story and her journey with ketamine as well. And at the end, we'll have some time for some question and answers. And if any of you are also on the call and you have any questions about ketamine, feel free to put them in the chat or feel free to wait till the end and then we'll dive into those. I just want to share a little bit about my connection with Paul and Jasmine. Joe and I had the honor of working with them in Sedona in a ceremony space. I remember when I first met them, Jasmine was like, "We're going to journey together, okay?" And I was like, well, "No one's ever done that, but let's do it." So they were the first couple I had who really, yeah, did their journey together side by side, and to me it was really a testament of their bond and their unity. And so I've always just seen that with them, and then I've watched them develop into what they're doing now, helping a ton of people. And I always tell people I have seen my own side of ketamine from our side from the Iboga space, but they're the only two I know who are holding it in a way where I've seen actual reverence and reciprocity. They have a foundation built onto it. So they're doing it in ways that I personally just want to commend you guys for the way you guys hold that. You guys treat it like a plant sacrament. Actually, we understand it was, created in other ways, which we'll talk about the history. But yeah, I just want to honor you both for holding it in the way you do. And without further ado, I would love for you guys to take over, share a little bit about your journey to where you're at, and then if you have the slides you'd like to share with the group.
Sure. Yeah, let's pull this up. Hopefully. Yeah.
Did you really want to?
Yeah, it's like, what are you trying to do? All right.
To go back or forward for the first one.
Okay.
All right. So can you guys see the slides okay?
Yep, we can.
Okay,
awesome.
cool.
So as he said, my name is Jasmine and I am an RN. I have my master's and then I'm a board certified psychiatric and mental health RN. And we've each worked in mental health for over a decade. And a background about where we came from. So I myself was working in mental health as a nurse manager. I was diagnosed with generalized anxiety disorder, major depressive disorder, complex PTSD as a result of trauma. And so when I talk about how ketamine literally stops the thoughts of suicide, I'm speaking from personal experience. And I realized how powerful this medicine was. And so then Paul and we started digging into the research and we were working at the VA at the time. So we tried for a couple of years to get them to start a clinic and we weren't able to. We kept running into like red tape and politics and things like that. And so a couple of years ago in the spring, we had like 5 veterans die in a few months from alcohol and suicide related issues. And I remember coming home and I just was talking to Paul and I said, I feel like I can't look at myself in the mirror anymore because before I was like sad when this happened, but I knew that we'd done our best. And at this point, I said, we know something that is super effective and we're not using it. And so Paul, being the creative person he is, he said, well, why don't we take a loan from our retirement and open our own clinic? And I was like, that's a crazy idea. And so we were thinking about it. And then we ended up at an Iboga retreat with Troy and Joe. And it was actually during that retreat that we decided for sure that this was the direction that we wanted to go. And looking back, I can really see how Iboga really influenced the way that we hold the medicine and how we do it. And so we really try to bridge that Eastern and Western model. We fully believe in Western and the science and all of that. But then we also see the limitations. I know, like for myself, I think they tried 4 different antidepressants before they found one that worked, and that was even with genetic testing. And I did, therapy for years, and it just didn't get to the things that we needed to get to. And so that's what brought us here.
Yeah, and my story is pretty similar. Growing up, I had depression, anxiety, and then later on was diagnosed with PTSD related to childhood and early adult year stuff that happened. I also, right as I started my nursing career, I lost my brother to suicide. And he was the fifth young man to die in my family from suicide in, the last couple generations. And that really kind of like prompted me to stay in mental health and try and figure it out. And so that's kind of what motivates us kind of coming into this process of being healers working in the ketamine space. But we decided to do it a little bit differently because what we saw currently in the space was a very profit-driven model. And we chose to not pursue it that way. So we're not a profit-first kind of clinic. We do a lot of reduced or free care for our clients. I mean, I would say probably over half of our care is, well, probably 75% of our care is reduced price. Probably 25% of it's nearly free. The foundation that we have running alongside the clinic is fundraising right now so we can shift to a sliding scale pricing structure so that all the services that we provide will be on a sliding scale for people. And that's really where our passion is like giving this access to other people, even though insurance companies won't adopt it and won't pay anything for it. We also include integration. So the research was really strong, saying that if you include integration, you don't have to keep getting ketamine for the rest of your life. You can have durable results or even curative results. And then we also approach it a little bit differently than just, we're not therapists, we're nurses, we're coaches. We're on a path of spiritual enlightenment and growth ourselves. And we bring that into the practice holistically by approaching people's, not just the trauma, but their spiritual processing and where they are emotionally, and then different lifestyle changes they're going through. We get a lot of people in midlife crisis or post-divorce or end of life. And so that's a pretty beautiful place to kind of work in. And we also see the medicine as just one tool in the toolbox. It's the catalyst for change. It induces neuroplasticity and allows people to learn new things and change their life. But it is just that. It's just a tool in the process of their healing. We really think that people are kind of their own healer and they can do a lot themselves. They just need a little bit of help and guidance along the way. So, yeah. And the last thing that we do that we really like, and it's really growing in those last kind of 6 months, is the medicine of community. We've started offering groups starting last year, and we're expanding those groups as we go. We keep adding groups, and our attendance has been really good. So people have been kind of finding the beautiful medicine that is community.
So a little bit about the background and where ketamine came from. It was actually developed as a dissociative anesthetic. And so it's been used for over 50 years in surgeries. It's still used in first responder settings. Our firefighters carry it for children, elderly, all of that, veterinarian clinics. But what happened is people were coming out of these surgical procedures and they were saying, oh my gosh, I had such a trippy experience. Or they were saying, my depression got better. I have a patient right now that she had a hysterectomy and she said the next day, I didn't know they'd given me ketamine, but I was like, what happened? Because the sun was blue and the birds were singing and it was the first time in my life I felt okay. And so she's since came in for treatment and with great effect. And so that's what was happening around the world. And so they started studying it for depression. And then about 6 years ago, the FDA approved Spravato, which is a nasal application of ketamine specifically for treatment-resistant depression. And so what that means is these are people that have failed multiple trials of antidepressant medications and can't find something that works. And so at first, ketamine was actually being used instead of shock therapy. That's how significant of patients they were sending to the ketamine. And so then what happened is when they approved the nasal version, that opened the way for ketamine clinics to start opening. And so when we're doing it any other way besides the Spravato, it's technically off-label, but it is very effective. And so you'll see ketamine administered IM, IV, sub-Q. You'll see the lozenges, the troches. And then, of course, when people are using it on the street, they're usually doing what they call bumps of it, and that's snorting it as a powder. Really cool. Ketamine is the only legal psychedelic option in the US for mental health. And if they had tried to approve it specifically for mental health, I'm pretty much positive we would not have it today. But it kind of came in with this back avenue. And so that's why we have it. It is the most effective treatment that we have when it comes to stopping thoughts of suicide. For instance, they were running out of beds in inner city ERs. And so what they started doing is they had people coming in suicidal that they couldn't find placement for, and then they were just taking up a bed in the ER for days. And so they found out that they could give them one dose of ketamine, and within a couple hours, they would stabilize to the point they could discharge them to the street to follow up outpatient. And so when we have patients that say they're feeling suicidal, we aren't worried about it. It literally turns those thoughts off. And so it treats anxiety, addiction, PTSD, insomnia, grief, and of course, the depression. A little bit about the science, and I'm going to kind of just run through this. So if you have questions, just hit us up because we could go really long on this, but we don't want to see your eyes glaze over. So ketamine affects the brain in multiple ways, which is part of why it's so effective. It affects your serotonin, dopamine, and norepinephrine, and then it also blocks those calcium ion channels. And so what that means is that it causes rapid mood stabilization. And so whereas typical antidepressants take weeks or months to have effect, and then you're tapering on, tapering off, and trying different meds, this works often after the first session. With the thoughts of suicide, we haven't had a person yet that came in with thoughts of suicide that it didn't stop those thoughts right there. It attaches to the opioid receptors. And so what's cool about that is it's not an opiate, but it causes the person to feel really positive and uplifted, and it decreases physical and emotional pain. And then it also rebalances the reward, pleasure, reward pathway. And so that means for people that are dealing with self-harm, and it attaches to those receptors, and then they're not struggling with that anymore because it literally rewires how they experience pleasure and pain. It also increases your BDNF, and then it blocks the NMDA receptors. And so with that, what it's doing is it's causing that neuroplasticity. And so BDNF is something that we see really high in children up to the age of 5, where they're really soaking in information like a sponge. And so ketamine does that as well. So it causes that neuroplasticity, promotes growth in the neurons, and then promotes them cutting off the ones that aren't being used anymore. And so all of these effects that you see over here, those are the things that we see happening with our patients.
Then I'll just add the opiate receptor activity is really interesting as far as a substance to work with for healing. So the dosing we give is psychedelic. It can be challenging, but because of the lift in mood, it really gives the whole experience a positive tilt. We haven't had a single person come out and say they had a bad trip, so to say. But they'll say, well, that was challenging or I was uncomfortable at certain points, but I felt at peace and I felt safe the whole time. And so it really allows us to focus more on the integration side without having to put someone back together. Like you can sometimes find after someone does like an ayahuasca journey or a psilocybin journey where they're like, holy crap, I just went to a dark place and it's going to take me a while to kind of come back to my body and mind again. And so just another benefit.
Now, a little bit more about the brain. So, when people experience depression and trauma, what happens is their amygdala or that midbrain actually gets larger. And so they're feeling more emotions, and it often feels overwhelming. And then there's a breakdown in connection between that amygdala and that prefrontal cortex. So, usually the prefrontal cortex steps in and it regulates our emotions. And so, say you get cut off in traffic, you have this emotional response, and then your prefrontal cortex steps in and goes, hey, maybe they didn't see me, or maybe they're having a bad day too. Do I really want to be mad about this? And then we move on with our day. But in people with this type of brain, with the trauma and the depression, they're feeling those overwhelming emotions, but there's that breakdown in connection. And so they can't regulate them, or it's very difficult to. And so that's where you see like that fight or flight happening or stimulus response. One of the first things that we see change with our patients is there's a space between that stimulus and that response. And so inevitably they come in and they say, something happened that usually I would have been upset for days or even a week about this. And instead it happened and I stopped and went, do I really want to go down that rabbit hole? And I didn't want to. So I moved on with my day. And so then we just start building on that. We actually call it boot camp for the brain. So it's like, now that you've got that space between that trigger and that reaction, now we're going to start building on that. It also completely turns off the default mode network, which is really beautiful because if you've ever driven somewhere and you're like, I don't know how I got there, that's your default mode network. It's things that you thought were done for so long that they're just hardwired in. And so some of the things that live in that default mode network are your critical self-talk, those thoughts of suicide, rumination, the thought loops or thought spirals that you get stuck in. And so what happens is ketamine turns that off. It allows us to have a more compassionate view of ourselves. And then it also helps people focus on the changes and the goals that they want to make instead of being stuck in the past and everything that's happened to them. And then again, it really helps with those thoughts of suicide. And then decreases those emotional reactions and decreases the fear, the anxiety, and the anger. I had one patient that was just radiating anger. And by the end of the session, he was talking, laughing, and we've been able to dig into like the deeper stuff that's underneath all that anger. And so it increases resilience, like nothing changes with your circumstances, but you feel like you can handle it. And then helps with that emotional regulation. So just that's kind of the highlights of it, but really amazing what it does in the brain.
All right. So, kind of what we're here to talk about is the safety and risks of ketamine. And it's really worth speaking about. So, ketamine, when used in a clinical setting, controlled setting, has a really low conversion to addiction. We're not seeing lots of people broadly amongst all the clinics, even if they're kind of doing this less ethically than I feel like they should. They're not having a lot of conversion to addiction. And that's a good thing, but there are things that make it addictive. And so kind of the physical risks of ketamine, one of the ones we watch out a lot for is blood pressure increase. So ketamine increases blood pressure by about 10%, a little bit more in elderly adults. Interestingly, though, there's not been any documented adverse events or fatal events related to this. It's just something that's of note that we track. More commonly, we see people get headache, nausea, and dizziness following a session, and usually with some hydration food in a few hours, that kind of will abate. There is a risk of drowning or accidental injury while intoxicated, and that's not something you find in the clinical setting, hopefully. But that's something that happens when people are kind of out and about and they're using ketamine recreationally. They'll do it in places that are unsafe, or they'll combine it with those other substances, which make it much more challenging to coordinate your movements. The major adverse effect of ketamine when it's abused is interstitial cystitis, which is a severe bladder condition that results from chronic use. And this typically happens when individuals are using more than a gram a day over a longer period of time, months or years. And what we typically give in the clinic is about 100 milligrams per patient per week, or oftentimes a lot less if they're a smaller person. So this is our weekly dose is 1/10 of the daily dose usually associated with this type of reaction. So we don't see this typically in the clinical setting, but it is definitely something we have to watch out for folks that are using it recreationally. Ketamine is also safely used at all age groups. So from pediatrics all the way to geriatrics. It's used in veterinary medicine. It's carried on the battlefields now instead of morphine because it's safer to use than an opiate. So when people become addicted to ketamine, it's not necessarily because of a chemical hook. It doesn't have like withdrawal like you find with heroin or alcohol or even nicotine. But people do seek out the dissociation, the euphoria, and the anesthetic effect. And so similarly to cannabis, where it doesn't physically become addicting, you get addicted to the sensations, usually the numbing of whatever you're trying to avoid. And so when you have repeated exposure to it, you have an increased risk. Ketamine is also very short acting. So people are redosing every 30, 40 minutes or even more frequently if it's small doses. And they find they get that rapid suppression of their anxiety, depression, and psychological pain, which is something that people seek out. And so we included Matthew Perry on here because, it has been the headline that has driven people out of ketamine treatment for a while. But I think it's worth noting because they kind of just blanket said like, oh, Matthew Perry was abusing ketamine and he drowned in a hot tub, which is part of the truth. The thing that's not really said, and I've only seen it in a couple articles, is he spent $55,000 on ketamine alone in the 5 weeks leading up to his death. He was receiving many injections a day of it. He was also combining it with Suboxone, and he was combining it with benzos. And so those are like black box labeled, do not combine. It causes respiratory depression, causes severe intoxication, and then he combined this with a hot tub. And so it really it's tragic that he passed away, but it wasn't necessarily because he was seeking out just the ketamine. He was abusing it horribly in really high doses. Also, as we've seen in the news, there was a bunch of unscrupulous doctors that were prescribing it to him because they were profiteering from it. And I don't know, it just makes me really sad that that's what happened. I'm glad to hear that there were some clinics that were like, hey, you have an addiction problem, like we can no longer treat you or contribute to this, but there were some that did not. So.
And also along with that, ketamine is actually being studied by the FDA right now for approval to treat alcohol use disorder. And so you really have this two sides of it, where on the one hand, you have people using it recreationally and getting addicted, and then it's also very effective for treating addiction. So if you're familiar with sobriety, only 5% of people that try to get sober make it to the first year. Well, in 2002, they did a study with 70 heroin users, and they gave them one infusion of ketamine. They combined it with therapy a few days after, and they were able to get that sobriety rate up to 18% at 2 years. Then in 2011, they did another study with 59 opiate users. They gave some of them 1 dose of ketamine with therapy and some of them 3 doses with therapy. The ones that got the 1 dose had a 22% sobriety rate at 1 year. So that's 4 times the amount you typically see. those that got the 3 doses with therapy had a staggering 50% sobriety rate at 1 year. These numbers are unheard of in the addiction recovery world. And so you really can see those two faces that are out there about ketamine, where you've got it being used on the streets and recreationally, and it becomes an addictive thing, typically because people are trying to avoid their emotions. And then you've also got where it can be used very effectively to treat addiction.
Yeah. And so after talking about the risks, let's talk about how we mitigate those risks. And this is more of kind of our personal approach to it and kind of how we see the most ethical way to mitigate the risks that do truly exist for ketamine. The first part of it is creating a therapeutic container. And so we are very careful about the container that we build for it. So we use psychedelic dosing. And the reason for that is there's a dose-dependent response. So you get better effect at a higher dose. And there's an upper limit to this. But once you get into the psychedelic dosing, you're kind of in the optimal range. This also makes it so it's not the most pleasant thing. They're putting on headphones and an eye mask, and they have a mantra to help them through the challenging parts of the situation, of the journey for them. And so it really creates this intention of, I'm coming in to do a serious psychedelic. I can't tell you how many times I'm sitting there watching my patient about to do the injection, and I'm like, are you nervous? And they're like, yes. I was like, you should be. Like, you're going on a psychedelic journey. This is something you should be prepared for, and there should be some apprehension. And that's a good place for them to be. And then when they come out of the journey, whether it was challenging, whether it was bland, whether it was beautiful, we do integration. And so again, within this container, we're making the focus the healing, making the focus growth, not really on them having a trip. That's part of it, and some of them do really enjoy that part of it, but we do a lot of hard work. We also limit the number of treatments. Most of our patients only get about six sessions. And then they're usually pretty good to go. If they come back for touch-ups, it's really as needed, and it's not a scheduled thing. It's not like, oh, I need this every 6 weeks or else the depression comes back. That's not what we've seen necessary, and it's not what we're seeing, what we're encouraging our patients to do. It makes a lot of business sense for them to come back repeatedly, but it doesn't make a lot of ethical sense. And then we tell our patients to avoid the home-based ketamine programs. So there's multiple online programs where you can get microdoses or macrodoses of ketamine delivered to your house with very little. I mean, you have a little appointment with a doctor, you tell them you've got anxiety or depression, and they start sending you a bunch of ketamine. And I feel like that just promotes that I have an emotion, I need a substance to cure that. And really what we focus on is, we're going to teach you the skills so that you don't need to have a substance to treat when you have a trigger. We all have days that are down days. We all have days where we get angry, but we can install those tools so we don't need a substance to fix that. So we also we come at this from a point of reverence and respect. And this is kind of our kind of founding this in some of the indigenous practices. So ketamine doesn't have a history, a traditional history of use. It was created in a laboratory. It has no plant base, but it has a very distinct spirit to it. It's something that we've discovered as we've worked with it, that it plays a lot like a plant medicine when you create the right container for it. And so we prepare our clients in the same way we prepare anyone for a psychedelic journey with a plant medicine. We do pre-coaching. We have a workbook they work through. There's all kinds of things that we work on prior to them doing the medicine to create that respect and reverence for the medicine that they're working with.
All right, so a little bit about our approach. As we said, we're trying to bridge that Eastern and that Western philosophies. And so we try to treat this with a ritual and the whole person, whole body. And so what happens, somebody comes in, we do the vitals, we give them an injection. They have headphones and an eye mask, they put that on. And we intentionally do the IM so they don't have to be hooked up to monitors and vital signs and things like that the whole time. We're trying to make it as natural as possible. So they have the first hour as the journey with the medicine, and then the second hour we do integration. And so with integration, we're tying in a lot of things. We use IFS techniques, guided imagery, breath work, somatic experiencing, things we've learned working with plant medicine. And so we tie all of that in, and we really just go with what comes up for the person. We tell them, we trust that your mind is like your body and wants to heal. And so your mind and the medicine are going to bring up what it needs to work on. And invariably this happens. It's really beautiful to watch. People are typically worried that trauma is going to come up, but actually what comes up is whatever that belief is that they need to work on. And so, for instance, I had this patient, and I think it was her second session, and she was so afraid of trauma coming up that her first couple, she couldn't even really keep an eye mask on. And so she comes out of the medicine and she's crying, and she said, I just felt love for the first time. And I was like, you're in your 30s. What do you mean? And she said, I realized that I always felt like I had to earn love. And instead, I'm worthy of love just because of I exist and because of who I am. And so, time after time, we just see these beliefs come up. As soon as that medicine starts kicking in, sometimes they talk and then sometimes they tell us after, but it's whatever that thing is that's in their subconscious. Maybe it's I'm not enough, or I need to try harder, or it's I don't deserve to feel good. Whatever it is, we just dive into that and that's what we work on. And so, as part of our thing, too, what we do is every time we do an injection, we give the person the medicine and we have them say their intention over the medicine. And then we have a mantra that they develop. And so we all know what we don't want in our minds anymore. I don't want to be depressed. I don't want to be anxious. I don't want to be afraid. But what do you want in there? And so when they've got this neuroplastic window, it's like we use that mantra to start redirecting the thoughts, to start putting into that mind the things that we want in there. And we want to get it all the way down deep. And so that this is what they default to instead of the other things they've been defaulting to. And we have a workbook. And so the workbook includes journaling, it has meditation. We encourage yoga, Tai Chi, that kind of thing. We tell them you have this 6 weeks of neuroplasticity because the ketamine, the neuroplastic window is a week, and we do the injections once a week. So they basically have this open window of 6 weeks. And we just ask them, what is it that you want to put into your life? What kind of patterns do you want to have? What kind of ways of thinking do you want to have? What do you want to change? And that's what we really dive into. When there's uncomfortable emotions, we don't push them down or ignore them. We dive into them. What's going on? What's under the surface there? We really go for quality over profit. And so for each person, we do spend that 2 hours with them. Paul and I are with them the whole time. And then we don't avoid, we use it to dig in. And then we're bringing the outdoors indoors. So as part of it, we have plants and waterfalls and we incorporate sound healing. Our community circles incorporate things like sound baths and cacao ceremonies. And then we'll do like the guided imagery or the manifestations with them. It's basically tailored to whatever that person needs to rewire their brain. And that's what we're going for. All right. So for this slide, I went ahead and included some graphs. What we do is we have our patients rate their symptoms like depression, anxiety, PTSD. And so they use these evidence-based scales and we'll have them do it before they start treatment and then as they move through treatment so we can kind of keep an eye on what's happening. And so these scales here were from a veteran. He had long-term sobriety and he'd been working in mental health, but he became worried he was going to relapse because he had been having more depression, anxiety, and PTSD. And so these graphs were over 6 weeks of treatment. So his anxiety, that's the top graph. It started at 21 and then dropped to a 1. His depression, that's the middle graph. It started at a 22 and then dropped to a 3. And then his PTSD symptoms started at a 56 and dropped to a 10. And we could literally sit here and show you graph after graph of different people. And this is a really typical response that we see. And so we have personally witnessed just how powerful and how effective this medicine can be. And we want to just share a couple of stories of some of our patients with you.
Yeah. So another veteran that I worked with, a younger veteran, and when he came in for his first ketamine medicine session, he was actively suicidal with a plan. And he had chronic SI, but he came in pretty hot that day. And so usually that'd be something that'd be really scary for a mental health professional. Someone comes in with suicidality and a plan, and you're thinking they're going to have to go to, be titled or involuntarily made to go inpatient in a locked unit. But with ketamine, it's different. So we just continued with the appointment as we were planning to. And so after we had him sit with the medicine and we did the integration, we were wrapping up, and I was like, how are your thoughts now? And I could already tell it was kind of a rhetorical question, but he stops and kind of looks inside and he's like, well, I'm not having any suicidal thoughts right now. That's really weird. And it decreased the intensity of them, particularly in those first few weeks where he was still having some chronic suicidal thoughts, but they weren't pressuring. They didn't feel like they were command thoughts. He didn't have a plan to commit suicide. By the third session, he comes in and he's got this big smile on his face and he says, I got engaged. And I was like, you got to be kidding me. So he's, 4 weeks into treatment now. And his partner, who was pregnant at the time, when he started treatment, he was almost catatonic, just sitting on the couch or in bed and not doing anything. At 3 weeks, he got engaged. By the end of his treatment, he was building an addition on their house for their new baby, working more, productive around the house, really doing a lot to be actively engaged with his family. Also had an interesting thing pop up with this gentleman. So, and it's funny, there's anecdotes from all these patients. But one of the modalities that we lean on pretty heavily is IFS, so internal family systems therapy. And we kind of have our own spin on that, but it's mainly based in that modality. And so sometimes we have past life stuff come up for patients. And so for him, we spent a good portion of our treatment time together working on this one part. So he was feeling a very large amount of frustration and anger, and he couldn't find where it was sourced from. And so we located this part. There was a wounded part we couldn't access because there was a very strong protector. And he identified the protector as being this like knight in armor, and was kind of a surly gentleman that we were dealing with inside of his psyche. And we spent about 4 sessions working on it. And then I decided, hey, we're not making a ton of progress here. It's making you more frustrated. So let's move on. And so he's sitting there, and I was like, let's do a manifestation of your future. And so instantly he grabs this necklace he has around his neck, which has a picture of his daughter's ultrasound. And the somatic pain that was associated with this protector was in his shoulder. And all of a sudden he just winces and he's like, oh man, he's like, that night's back. And I was like, well, let's talk to him. He popped up, let's give him a chat. And so we start talking with the knight, and a third part entered into the scenario. And it was the father of the wounded child. And all of a sudden, this kind of story unfolds. And, up to this point, we'd kind of gathered that this part was very old. It was kind of a legacy burden that he'd been carrying probably through his bloodline. The trauma happened during the 100-Year War, to the best of our knowledge. And so we're talking 1500 when this happened. And so the father witnessed the sacking of his city. The knight was the protector of his child. And so with this third element involved, we were able to actually resolve the part and work through that. And so he had this huge weight of relief lifted off of him. The frustration kind of started going away. And he was like, oh my gosh, I feel like this huge weight's been lifted from me. Well, a couple days later, I get a text message with a picture. And so about 3 to 6 months prior to our session, he was doing sandbox therapy. So he was using toys in a sandbox to recreate kind of images of his psyche. And so on this image, in the sandbox, there's this giant dragon in the middle of it. There's a knight, and there's a little chapel and the princess. And this is what had come up for him before he even knew what was there. Before he even knew that this legacy burden had existed, he recreated it in the sandbox session with his therapist. And so he was like, oh my gosh, I just found this picture. And you have to see this. And it was pretty spectacular. So, when we talk about the magic of ketamine, like it really is broader than just trauma. It's broader than just teaching some people new skills. Oftentimes we're working on, very deep spiritual things like past life burdens and karma. So
I had a patient, so her mom had died when she was 15. And so she came in, she did her first session, half dose. That's where we start everybody at. And she has this beautiful experience. She's like, I talked to my mom. My mom told me I could let go of that depression and what I've been holding on to. And it was really life-changing. I remember talking to her after she had finished treatment, and she said, my anxiety went away so much that the next time I felt it, I didn't even recognize what the emotion was. I had another one. This girl, she had really bad body dysmorphia. And so for her, she would feel like her hands were several feet long and her body was made of paper mache. And so she was in the medicine and those symptoms came up. And so we started working on it. And as we're diving into what is going on, like, why is your body feeling like this? What memories are associated with it? She started remembering things from when she was 4 years old, but she knew that there was abuse and trauma there, but some more specific ones connected with how her body felt came up. And so as we're processing it, she goes, oh my gosh, I can feel my legs. They're normal again. And then as we kept going, she's like, I got my hands back. And so it was the most beautiful thing to watch her literally recover the sensation of a normal body and be able to be in her body. And then as she moved through treatment, she's like, those symptoms aren't there anymore. I had another patient. So he came in, he really dealing with anger. All he could feel was anger. And so he's in the medicine and he starts talking in another voice and was like choking something in the air. And so thanks to Iboga, actually, I started being able to work with energy and learning pranic psychotherapy techniques. And so I started doing energy healing on him. And when he came out of the medicine, he said, he goes, I could hear a female voice talking to me. And then he said, I was standing there in space and somebody started putting armor on me. And he said, and then I was able to continue on my journey. And he was literally night and day a different person. I have not seen him in that state of anger again since. And I thought it was really intriguing because one of the things that I was doing to him when I was doing the energy work is I was doing the shields on his chakras. And so that was, again, things happen and I'm just like, wow, I have no explanation. I had this other female patient and she said for her in the medicine, some stuff started coming up about a breakup that had happened decades before. And then she'd also had an abortion at that same time. And so as we're working, she said she was talking to the soul of her baby and she stops and looks at me and goes, is it possible that my baby reincarnated in my firstborn? And I was like, it's possible. And she was like, that's literally what I was just told. And she was so blown away and it completely changed her perspective. And I was really surprised too, I have to say.
Yeah. I think when we talk about the spiritual side of ketamine, one story comes up, and it was an early patient that we treated, who's become a dear friend since. And so his first sessions, this half dose, he comes in, he's like, his intention was extremely clear. He's like, I want to go to my safe space, which was a forest glade. He's like, I want to meet Jesus there. I want my wife to be there. And he's like, I want to meet my inner child. And I was like, well, we can ask for anything. We'll see what the medicine brings up. Because oftentimes the medicine does what the medicine wants to do. It has its own mind at times. But sure enough, he comes out of the journey and he's like, tearful, smiling. And he looks over and he says, oh my gosh. He's like, I was in a forest glade talking to Jesus and my wife, and my inner child comes running out of the forest and just kind of absorbed into me. And for him, he came into this really struggling. He was a strong Christian, but he was struggling with his faith because he didn't have any tangible proof of it. And he came out of this with a really strong conviction of his faith and his belief in God. And it actually softened some of his beliefs around religion. Whereas before it was kind of dogmatic, it became much more of a personal relationship. It was him and Jesus and God talking and his family. And so I think it's really beautiful kind of how ketamine really adapts to each person. I've had people come in who are atheists, and it's not like it's ramming spirituality down their throat. They have an experience that's very appropriate for them. I have highly spiritual people come in and they have really profound experiences where they touch source or creator. Or Christians come in and they have a very Christian-centered experience. And so I think that's kind of one of the beauties of it, is that it really meets people where they're at.
So that's really what we've got for today. This is our contact information, and we just wanted to turn it over for Ursula now and for questions after.
Thank you guys for sharing all of that. Yeah, and just so you guys too, if there's any information on the science, we're gonna have this presentation shared on our YouTube page, so you'll be able to dive back into that. And then yeah, we'll also email out the contact information for Paul and Jasmine too. I know they have a lot of people who do come from out of state to work with them, and anytime someone is interested in working with ketamine, they're the only people I humbly would refer anyone to. So now I would love to pass it over to Ursula. Ursula is a dear sister of ours who is going to share sort of the other side of ketamine, and her journey into it, how it sort of supported her in her what she was going through, sort of the addiction phase to that, and then her recovery process. So Ursula, feel free to share.
Thank you, Joy. And thank you, Joe, for creating the space of expressing my side of the story. And thank you, Paul and Jasmine, as well. I think also being a provider of any medication is very important, how you're providing the medicine. So the way you hold these clients and save lives is amazing. My story is very, very different to that. I grew up in a community, moving from Africa to New York. It was, I had to deal with learning about trauma myself, and ketamine became something that my society was easy to attain, and we used in groups. Then I became more deep and deep. I liked the feeling of the euphoria that it would create, feeling out of my body. I had very intense also experiences of connecting with spirits at one point. And then I started using and being comfortable using it on my own. So now I started depending on that feeling with little densities daily. I didn't like my job. I didn't like where I was. I didn't like where I lived. So let me just do this, and then I'll go and try to dissociate myself from my reality. So when ketamine became something that I felt like a safety blanket to cope with daily life, with the years passing, I never felt any side effects of ketamine that were negative until using for over 4 or 5 years. My tolerance became higher and higher. I was definitely taking a lot of it when depression came, when anxiety came, and slowly I started feeling that I was dissociating myself from my womb. I felt a lot of, first it started as a urination frequency, which I was, oh, maybe I have to go to the bathroom more than usual, but I didn't feel any pain. So as the symptoms became bigger and bigger, I felt that I was losing appetite. I I didn't, I felt like I needed more of it to now numb these symptoms that it created itself. So now I wasn't just using it for emotional numbing, I was using it for physical numbing. What I want to express here in this space is my concern about people that are around this substance and have absolutely no therapeutic modality to use it. And it's so big now, it's becoming more popular and now it's legal in some places. But to my knowing, the people that I've been around, it was very easy to attain it. So not only myself, but I have a lot of people that I knew and that had the same symptoms. So I already knew it was coming from the ketamine use. My concern was that I struggled for many years with doctors not understanding and knowing how to heal me now. I was in a dark space of I didn't know where to find a solution to these symptoms to now having troubles in how to live like a regular life. Imagine you not being able to sleep for more than an hour, half an hour, walking anywhere. You felt really intense pelvic pains. I went to many doctors and they did sonograms. They found that there were fibroids on my bladder and my uterus, but they still didn't know what it was. So they asked me to do biopsies, and I never wanted to continue doing that. I was very scared to put my health in these hands of these doctors that don't even know what ketamine is. Yeah, I was in a very dark place where I didn't know who to trust anymore. And now I just only trusted ketamine to numb these symptoms daily, but it was also becoming worse and worse, and it was metabolizing in my bladder more and more the more I put more, and the bladder retention decreases highly. The last doctor I went to, which is after 5 doctors, and I also did rehab, they were not helpful at all. I was basically just doing a break, but I relapsed right away coming back out of rehab. After the 5th doctor, he said, I can do the same, I can run the same tests, I can do the same sonograms, we can go the same procedure, but you have to get first deep into the addiction, why you're using this. So basically it was just, if you stop, then we can heal you. If not, then we can do as many procedures as you can, you're required to, but it's as soon as you put the ketamine again in your system, the symptoms are gonna arise again. So a year ago, I heard of Iboga through a dear friend, Joali, and I didn't feel called at that year, which was like a year ago. And one day I was just in just so exhausted and so tired of my reality of having to take ketamine and how to climb out of the usage. And I started using the ketamine to being able to not feel pain in my bladder. Then I was so depressed and in my room, and I just opened my laptop, and the first thing I saw was Iboga as being the #1 addiction plant medicine. And I said, after doing so many medical exams, I said, if Iboga doesn't help, then there's really no hope for me. Then when I saw that ketamine was also used in clinics, but for me, it's just I was too deep into the ketamine use. And I called up Joali and I said, this is what's going on. And my first ceremony with Iboga, and it's a lot to go over with Iboga. It was a beautiful plant medicine that helped me get to the root cause of my anxiety, my depression. It was a journey to face myself. And as soon as the first ceremony, the first hour, I would think, or maybe a little more, I didn't feel any pain anymore. I didn't need to go to the bathroom. I just didn't feel any pain. And once I went into the journey, I started also being able to understand more of the addiction. It wasn't now a band-aid to put on this addiction wound. It was more like you're gonna face what you're addicted to. And it showed me that I was in comfort and I would say, addicted to feeling pain and suffering. So that was a comfort zone that I was in. I didn't know how my life would be just being sober and happy. I didn't understand that anymore. So what Iboga showed me was a jump start of how to feel without pain and facing those um, those wounds that we all carry, those traumas and things. It was just like a direct healing, and I couldn't believe how much of a miracle that was. However, my brain was still addicted to the pain, so I didn't understand why I wasn't feeling anything anymore, any pain. But slowly with my recovery and doing the second ceremony, I became comfortable in not feeling and not needing any ketamine and not feeling like I needed anything to enjoy life. Iboga served a great tool for me, as we use all these substances as tools, but Iboga helped me cure my addiction and my pain. Yeah, I don't know, Troy, if you want to ask any questions. I'm kind of going dabbling everywhere.
Yeah, no, I think I appreciate your share, and I think the vulnerability is in the space is really, I think, the gift that you brought to us. Yeah, I guess if you just had anybody out there who's interested in working with ketamine, what would you say for any advice to them from your end?
It's very difficult for me to go to ketamine as a healing tool, especially as I use ketamine as to heal small places in my life, but as a long-term tool to face whatever issues you have, I don't see ketamine as, as the main tool to really face yourself, because you can dissociate. Ketamine is you dissociate from the feeling, but what happens if that feeling comes again? What happens if you feel those things again? Then your brain starts getting addicted to, okay, I'm gonna use a little bit more, a little bit more. So you start putting a band-aid to a wound that keeps bleeding instead of just going in the womb and really facing that issue. And that's what Iboga did for me, was face everything now
Yeah,
and
yeah,
just face it.
that's beautiful because it speaks to what Paul and Jasmine are talking about why there's so much importance and the need for you to, if you're going to work with something like ketamine or anything, to have trusted facilitators and providers in the space who know how to hold it. Yeah, like I said, I worked with Paul and Jasmine for a while, and the stats in their clinic kind of show that it's something that can actually heal a wound. But I think what we're both saying from two different ends of the spectrum is the need for trusted education, awareness, and providers. And anytime, even Iboga can be a tool. I've seen Iboga damage people. I know I've shared this with some people, but the thing with Iboga is it's a double-edged sword. The neuroplasticity is objective. And so if you ingest a lot of Iboga and you're abusing it, and what I mean by abusing it is taking advantage of other people, if you're doing things out of alignment, the neuroplasticity is going to rewire you to be so far ingrained in that you're done. And that is almost a worse sentence in a lot of ways than some of the physical symptoms that come from some of these other medicines. And so anything can be abused. The point we're trying to get around in this call is that whether it's Iboga, ayahuasca, 5-MeO, psilocybin, anything, just make sure you're working with people who are clear in their hearts and really doing it from the right stance. I know Dr. Dingle on the call represents a psilocybin place in Jamaica that does things very ethically. We have Paul and Jasmine, of course. Joe and I do our best. There's people here like Emily who are working with Combo now, are getting trained. And so just the point I'm getting at is do your homework, please, when you come to work with anything, and really vet the people who you are coming to sit with. Ask them to show you some of the data. Ask them to share testimonials with you. The last thing anyone wants is to see these plants or these compounds, these molecules be used in ways that they're really not intended to, because they're meant to do good in this world. And so, yeah, I just want to thank you, Ursula, for sharing your story and for your bravery. And it's been beautiful watching you on the back end of this start dancing again.
Yeah, for sure. Thank you so much. Yeah, it's very important. Thank you so much for giving me a voice too. And I want to put more concern of the people that I wish that, were like me and very in the dark space of ketamine and the side effects. Of course, everything has a side effect.
Yeah.
Yeah.
Thank you
Yeah.
so much, Ursula. And thank you, Jasmine and Paul.